Can you imagine being sick and need to support your family, and all of a sudden you have a health problem and you can't afford to go to the doctor for private pay because you're not insured? And what happens? You go to an ER, you get acute care, but you don't get the care that you need for chronic care management. And it's a vicious cycle.
It's real depressing. You ain't got no health insurance, like I said, especially if I had it that many years. It's like now the time I need to use it, I don't have it.
Free clinics are actually the safety net to the safety net. And what we do is we make sure everyone has access to quality and equitable healthcare. The Florida Association of Free and Charitable Clinics is a membership organization that is organized by free clinics where we connect and we share ideas and resources and even advocate for the people that we serve through our communities.
The Florida Association of Free and Charitable Clinics is the mother of all the clinics in the state of Florida. We look to the FAFCC for guidance, for protocols, for best practices, for trends, everything that we need to help our organization be successful. It is our voice in Florida with our legislators. Before our state association, we had no voice. So it makes each of our own clinics stronger.
The strength the association has is its ability to leverage our collective power to make an impact in the ever-growing healthcare sector.
The people that come to us, the vast majority have not had medical care for years, in some cases decades. The only kind of access that they've known is simply going to the emergency room. And we have patients who have, because of chronic illnesses, have gone to the emergency room 3 and 4 times per month because their chronic illnesses are not stabilized. And both the providers and the patients are stressed out because of that. So when they come to us, many come in tears.
I lost my job. So in the process of me finding another job to get health insurance, I got sick. After all those years of having health insurance, because I was with the school district like 8, 9 years, that little bit of time I ain't had no job, that's when I got sick like that. Weird timing. Because I was in the hospital, I had an abscess. I was at that hospital. They actually gave me a number to a community center, so that what made me just call them. And then I called them and I was like, look, I don't have no insurance. I just lost my job and all that. It was like, all right, just come up here, come see us. But this time, like, it was real depressing. Because it's like, you don't got no help. The hospitals, nobody don't want to, you don't have no health insurance. You go in these places, they're going to treat you like trash. There's no way I could afford it, because if I would have called the doctors, they was like $250, $150, $300 to change a bandage. I got to come here every day. I'm not rich. How can I afford that?
I was having a blood pressure problem, but my blood pressure was very high when they sent me over here. So in the last 3 years, I get in treatment for my blood pressure, and it's very normal right now. It's very good. Excellent. With my blood pressure, it's going down. Excellent. But I'm still taking the pill. I'm still getting the medication. Every 3 months, I have to buy, they give me half price to buy at public. It's very, very good because I got no insurance. It saved lives. It saved a lot of lives, I'm telling you. Believe it, because you have a lot of poor people live right here in West Palm, but cannot manage. When I come to this clinic, I can't believe it's full every day. I'm telling you, and people are getting attention. I'm telling you, good attention. Because sometimes maybe you don't have the money to buy the pills, and they gave it to you. And I get a lot here for free.
When you support the Florida Association of Free and Charitable Clinics, you're supporting over 100 clinics across the state of Florida who provide free healthcare to low-income, uninsured individuals. Thanks to Florida legislature's support, Florida's free and charitable clinics served over 200,000 patients through 500,000 visits with the help of more than 10,000 volunteers. Our patients are treated like family here, and we care for them as family. So we go above and beyond, connecting them to other organizations and doing a warm handoff to make sure that they're just not falling through the cracks between visits and appointments.
She would always just be like nice when I came in here, even if I was having a bad day. And then my mother was dying at the time, so that it helped me a lot to come here. Like, even though I was coming here for a crazy reason, it was a bright spot of my day.
I see the people come through the clinic and they're frightened. They're unsure of what's going to be happening. And when they leave, they say thank you. They're smiling, grateful. And that keeps me coming back. I've always said I can work really, really hard and go home exhausted, but I feel so good about what we've done and the impact we've had. Makes it all worth it.